welcome to Soni Irabor Live. Well, today I have someone that I think we should share his experience and legacy, with, and then maybe also discuss further about healthcare delivery in Nigeria. I say that with every thought and commitment to the fact that we do not have enough to do with healthcare delivery. Well, I'm very happy to meet and ask you to meet Professor Ajovi Scott Emuakpor. Am I correct?
You are very correct, sir. Thank you.
Professor was CMD, that's Chief Medical Director of the University of Benin Teaching Hospital in 1982 to 1988. But thereafter, he disappeared. And I'm just seeing him for the first time. Since then, that would be like 40, God knows, maybe about 42 years ago or so. So you're very welcome, sir.
Thank you.
Now, I want to find out from you where you are now and why you disappeared.
Well, first of all, a little correction.
Yes.
I was really never a substantive Chief Medical Director of University of Benin Teaching Hospital. Oh, okay. I was the Director of Clinical Services and Training, and also Chairman of the Medical Advisory Committee. And by that position, I acted as the Chief Medical Director at UBTH for a substantial amount of time before.
When you say amount of time, how many years?
Well, I will say between 1984 and 1988, I must have acted several times. Yeah.
Right. Okay. Now, why did you leave for wherever you went to?
Well, there are several reasons. First, I actually trained as a physician in America. I did not train here. And so...
Physician in America, what special area?
Well, I trained as a pediatrician, as a children's doctor, but specializing in children's blood disorders and cancer of children. That's my specialty. We call it pediatric hematology oncology. Okay. That's my subspecialty, yes.
Right. So you were in the U.S., and then you went back to the U.S. from UBTH.
That is correct.
So you've been there since then?
I have been there since then in the same university where I trained, in the same university that has recruited me. Every time I came back to Nigeria, I actually came on leave of absence from the university because we are humans, and sometimes we feel very guilty. Why am I here doing all of this in a place that has plenty? You see?
Do you think we have plenty?
No, I'm talking of in America.
Okay.
Why am I in America
Why
doing
are you in America?
all of these things that I'm doing? Okay. Being acknowledged, being celebrated for my expertise in a place where they have plenty. If America wants 100 me, they can train them within a year. You see, but Nigeria cannot train another me for several years because the instrumentation for training and the facilities and infrastructure for training a person with my expertise are not there.
Whose fault
readily
is that?
Available. Well, it's difficult to assign fault, and the reason why I say that is this. You see, a number of people, well-meaning, believe that subspecialty trainings is not what we need now. What we needed more is just primary care training, where we can extend healthcare to everybody. People believe that preventive medicine is what we need to focus our attention on to prevent the diseases to begin with, which is a common theme globally. And I do agree with that to a large extent. But the ecosystem we have in Nigeria for healthcare has not permitted the full realization of that type of...
I think you've been very careful and guarded about your utterances on this matter.
Yes.
Because I live in Nigeria. I've lived in Nigeria all my life.
Yes.
And I hate to say it, healthcare delivery has not been given that measurement that we expect other countries to, that we should be done here.
I cannot disagree with that. I think you are very right. And I am being, if I sound guarded, it's really not because I wanted to. It is because I'm trying to understand the mindset of the leadership, people who are making policies on healthcare. I want to think about what they were thinking about when they come up with these decisions. Nigeria has actually been in the forefront of fighting for health for all. Nigeria participated in the WHO declaration, Alma Carta Declaration of Health for All by the year 2000.
Which
we have gone past 2000, that's 24 years ago.
Yes.
And we still haven't achieved it. Nigeria also went to the African Union and stated that in regards to healthcare, all nations must devote about 5% of their gross national product into healthcare. Nigeria sponsored it. That Nigeria itself has not been able to achieve what they sponsored.
That is very sad to hear. But why would that be the case? Why would I sponsor something and I will not be in the forefront of leading the process of showing or leading by example, as you could say? Why?
Well, again, I don't know what is motivating or what is creating this problem. I cannot tell you because I'm not in the political circles. But politicians will tell you that, well, when you're in politics, then you know exactly that when you are allocating funds, there are political considerations for allocating funds. I keep telling them that whatever political consideration there is, healthcare should take priority.
True.
Because the saying that a healthy nation is a wealthy nation is true and has been true for centuries. If you don't keep your population healthy, then you cannot be wealthy. Wealth will continue to be stuck in a few hands, and they determine and manipulate the system to their advantage.
You've been away now for more than 40 years, and one would expect that once in a while you come home, share your ideas with people in government, share your ideas with your co-professionals. But do you see that happening? Has that ever happened between you and them?
Oh yes, many times.
Okay.
Many times.
Let us share some of it.
Yeah, for instance, I have, since I've been gone, I've been back here on several academic missions. I've given a keynote address to the Pediatric Association of Nigeria. That was in 2002 when they met in Asaba. And I spoke to them extensively about sustainable development, how the recklessness of our industrialization have completely obstructed the health of the people. For instance, all of the exploration of oil and exploration of natural gas in the Niger Delta has completely decimated the Niger Delta. Fishermen can tell you that they cannot fish successfully anymore. And even if they did, nobody knows the content of that fish that we eat. All right. The farmers will tell you all of the flaring of gas has completely decimated their farms because of the heat and all of the pollution in the atmosphere. Their crops are not growing as well as they should grow. So even the farming, everything that sustains life and sustains health was affected by the exploration of oil. But the people who are benefiting from it, the multinationals, the Nigerian elites who benefit from it, really don't care. They don't care because their health care is not determined here in Nigeria. When they are sick, they go abroad. And in fact, most of them have their families abroad. So it doesn't matter to them. So that was the theme of my keynote address.
Yes.
Then, of course, the Nigerian Medical Association invited me in 1960 during their 50th anniversary to deliver a keynote address.
2010.
2010.
Yes, I remember that.
Yes, 2010
okay.
in
Right.
Abuja. And my theme there also is I talked to them about the evolution of healthcare systems in Nigeria, and told them how Nigeria has one of the worst healthcare indices in the world. For instance, life expectancy, infant mortality, maternal mortality. It has reached a stage in Nigeria where pregnancy is a disease, literally. Because if a woman is pregnant, you are not even certain that when they are going to deliver, they'll deliver successfully. You never tell. So all of these are the things I mentioned, and I try to postulate, I try to state which way forward.
What was the reaction to your
It
lecture?
was very well received by my
But did it
peers.
influence any decision process by any
The
government?
only way it can influence the decision process is by advocacy. Okay, and again, that was part of my presentation to them. You see, you cannot continue to fight the government by incessant strikes and expect the government to listen to you.
But the people are suffering. That's
Yes,
the problem.
yes, true, true. But you see, our profession in medicine does not even condone a physician saying that I'm not working anymore. You see, we took an oath. The oath we took is called the Hippocratic Oath. That Hippocratic Oath does not include refusing to take care of a sick person, you see. But the Nigerian government has almost always seduced the association into strikes by refusing to do basic things. And the association allows that seduction to take place. They seduce them, then they do something, then everybody says, oh, look, you see, doctors are...
And the people suffer.
The people suffer, you see. So, so my presentation to them is that let us adopt a different style, you see. Let us continue relentless advocacy, even if we have to pay professional advocates to help us tell our story, to help us represent the people, because the people are suffering. Yes.
There's something about this whole process that I'm looking at. There's the presidency, there's the National Assembly or the legislature, there's the judiciary, and then there's the rest of us.
Yes.
In all of these, healthcare delivery and education is for everybody.
Yes.
So, you mentioned the Hippocratic Oath. When we come back, we'll get back to that question I was about to ask, and of course, the Hippocratic Oath, and then we'll be finding out some more about why Nigeria is the way Nigeria is regarding healthcare. We'll be right back. Welcome back. Yes, I was asking a question, regarding how Nigerian government, Nigerian people, everything is moving together, I suppose, for good, but it's not always the case. Then we talked about the Hippocratic Oath. My question, sir, and welcome, of course, I'm talking of Professor Ajovi Scott Emuakpor. That name is a powerful name, but we'll talk about that later. Let's get to the issue of the day. I'm worried about Nigeria's seeming indifference towards healthcare delivery. And how does that encourage or discourage or motivate you and your colleagues?
Well, I'm glad that you qualified it as seeming indifference. Publicly, we cannot accuse Nigeria of being indifferent. And why? We have a federal ministry of health, a ministry, a cabinet position devoted exclusively to health. In every one of the 36 states, they also have a cabinet position devoted to health. So on the surface, they have not neglected health, on the surface. What is more important is what facilities have they given to those positions for them to execute policies and the ideas of caring for the people. You see, the truth is this: health care is not a privilege. It is the right of every citizen to have adequate health care, adequate access to health care, and that must be provided by the government.
Is the government aware of this? That's the question.
They are aware of it.
Why are they indifferent, or why do they sound as if they do not know?
Well, this is the problem of the political class. You see, the political class has stratified Nigeria. Okay?
Knowingly or unknowingly?
Well, probably more unknowingly than knowingly. The middle class is what drives any economy.
Do we have it in
We
Nigeria?
don't have a middle class anymore. We now have the rich and the poor. And when people come to Nigeria and see the amount of affluence that is displayed publicly, they cannot believe that Nigeria is a poor country.
But side by side, the amount of poverty.
Yes. The poverty that is so glaring. I mean, it's not even hidden. It's there, facing you, confronting you every day. So, I am not a politician. I've never been a politician. I don't even know anything about political science. But common sense tells me that we have to have people who believe that it is a privilege for them to serve us, rather than who feel that we should be privileged that they are serving us. We need those class of people, but many of them do not have the resources to go into politics. Even if they do have the resources, they probably do not have the connections to go into politics. Politics has almost become a cult. It's like a cult where you have to worship the cult leader for you to be anything at all, even from the level of the local government, all the way up to the National Assembly.
You brought something that is a bit sore in Nigeria, local government, the relationship between, you see, I mentioned earlier the presidency, the judiciary, and the legislature. Now you also have the presidency, the state, the local government. But there's a general belief that the local government does not exactly exist, or is not given a chance to breathe the way it's supposed to. Otherwise, is it not the same local government that should take care of the people?
Yes.
And therefore show that primary health care is, as you said, a right?
Yes, it is.
But that's not happening here.
All right.
Or am I overjudging?
No, you're not. When I was at the University of Benin Teaching Hospital, one of my charge from the minister is to make sure that all of the primary care centers we have claimed to build are functional. And it was indeed very effective. We went to Bona, we went to Do, we went everywhere to ascertain that we have a primary health care that functions. But that is nothing. It's just a drop of water in a bucket of notion of. You can't achieve much unless there is a spirited effort backed by policy and backed by resources to achieve it.
I don't understand, because it's the same people that vote people into power.
Yeah.
It's the same people that at the end of the day are not taken care of.
Yes.
But there's a lot of promise made, during campaign, that when you do this for me, I will do that for you.
Yes.
But they don't seem to, that symbiotic relationship doesn't exist after elections. I need to find out from you, being a staunch, I should say, professional in healthcare delivery, and one who has also been in administration, healthcare administration before, why the people cannot fight for their rights.
Well, people who have very little, people who are marginalized, they just look for any straws to hang on to. So if I cannot afford 3 square meals a day, even a single meal a day, and then you come and you give me 5,000 naira, that is big for me. 5,000 naira I've never seen before. And I become loyal to you. So what has happened is that the elite class have used their wealth in silencing the masses. Okay. And it's so easy for the masses to be silenced, particularly masses that are oppressed, you see. And I think this is in the area of sociology, so again, another area where I have no expertise whatsoever. But it's common sense, you know. I think our people, I mean, no, everybody wants to be in the good books of the political elite. You know, they hand over crumbs to you.
But that should be, it should be the other way around.
It should be the other way around, yes, absolutely, absolutely.
As an administrator, many years ago, you saw the establishment of teaching hospitals. UBTH, Lagos University Teaching Hospital, Lagos State University Teaching Hospital, two in Lagos, UNTH, Ahmadu Bello University Teaching Hospital, Jos Teaching Hospital, and so on and so forth.
Yes.
There, of course, there's Enugu, University of Nigeria. So. Why were they established? If they could not ensure a level of, 1, center of excellence for health, 2, delivery of health, you know, to the ordinary man, to the average Nigerian. Why were they established?
All right. That question is very, very, very good. Why? A lot of people do not understand that teaching hospitals are not meant to care for the people, for the general masses. Teaching hospitals is to train physicians.
Okay.
That's why they are called teaching hospitals.
Okay.
Not only to train physicians, they are also meant to provide high-level subspecialized care, okay, where the secondary and tertiary, secondary healthcare systems have failed. You go to the tertiary healthcare system, which is a teaching hospital, to seek consultation and to seek expertise. That's what they are meant for. And to the extent that they have actually succeeded in training all of these physicians, they've succeeded very largely. Okay. Teaching hospitals also have come to the realization that just maybe, they need to go into primary health care. And so a lot of teaching hospitals, like Ibadan, for instance, they established an outfit in Irabor, which is a primary healthcare system, and it's the university teaching hospital, to train physicians
at that level.
At that level, by primary healthcare. So to the extent that we have succeeded in training our doctors, they have performed what they were established to perform. And so I don't fault the teaching hospitals at all. If you look at the instruments that establish the teaching hospital, that is their charge.
Okay, why should they depend on government then? Shouldn't they have a way of getting endowment and maybe funds raised from patients and all of that?
Yeah, all right, there you go. Teaching hospitals are not supposed to raise funds.
Okay.
You see, because the Nigerian government says healthcare is free. At the time I was here, they said healthcare was free. So in fact, in my teaching hospital, 90% of the drugs were consumed by staff.
Welcome back. This is Soni Irabor Live, and we have Professor Ajovi Scott Emuakpor, our guest today. There's a lot about healthcare delivery that we're not even taking seriously. And he has enlightened us from his experience, from his legacy, from the way he's even interacted with people in government. One will understand that we have a long haul for Nigeria regarding healthcare. Now, Professor, if I were to look at the flight, the capital flight or professional flight, I don't know what to call it, medical doctors have always left the shores of Nigeria. You're one of them, unfortunately. But then they don't want to come back, but you managed to come back. And you've been coming and going. Can you just sort of let us know, one, why are the doctors going away? Two, why are many not coming back as one would have expected them to come back? And then what makes your case more different?
That is a very, very difficult question for me to answer, and I'll tell you why. Is it really a bad idea that the Nigerian doctors are leaving? Or is it a good idea?
Well, to the extent that the Nigerian populace is suffering, it's a bad idea.
Okay. You see, another person will argue differently. Will say that what you consider as a brain drain, is actually a brain gain.
Okay.
And why is it a brain gain? It is a brain gain because what these Nigerians have done, they have gone globally to show that
we can do it.
We can do it. They've gone globally to prove that we can educate our own people and they will be competitive globally. Nigerians make up 70% of all the black physicians in America.
70%?
70% out of every 10 black doctors is a Nigerian.
Wow.
The respect that Nigeria as a country gains from the Nigerians in the diaspora cannot be quantified in terms of monetary returns. All of this 419 and fraud about Nigeria and all is completely buffered by the excellence of those Nigerians. Not only in medicine, in every field of endeavor. Nigerians are in astrophysics, Nigerians are in engineering, Nigerians are in the law. You know, some of the boys who prosecuted the Trump people are Nigerian boys.
Wow.
Okay?
Okay.
Today, as I speak to you, the Deputy Secretary of the Treasury of America is a Nigerian boy. So these boys are there projecting the image of, and they don't hide the fact that they are Nigerians. They don't change their names to camouflage anything. So to that extent, they have actually put Nigeria in the map to be recognized. When Trump said that all these people from countries like Nigeria use those terms to describe us, the American press took it over.
Yeah.
And they started listing the Nigerians that are making impact and are contributing enormously to the economy of Nigeria. So to that extent, it is really a gain. But on the other hand, actually, these Nigerians are bringing skills back to Nigeria. All we need is a receptive population to accept it. Fortunately for us, for me particularly, my return with skills and with ideas have been very well received by my colleagues. And some of them have actually helped me in the implementation of some of these ideas. So it is not all lost, okay? Having said that, now I can answer your question.
Okay.
Every professional wants a playing field which is even for them to compete. Every professional. The Nigerian health ecosystem has not left such an even playing field. So you cannot have all of these skills without knowing that you can actually utilize them for the benefit of humanity. Okay. So leaving this country to go and explore places where you can practice your art and your profession with dignity and with acceptance is not a bad idea. It is the yearning of every professional. So to that extent, therefore, if we can create an enabling environment within this country, which I think is being done gradually by very, very wonderful young physicians. I can name some of them, the president of the Association of General Practitioners of Nigeria some time ago. I think his name is Jimmy Adeyeye Rigusala. He himself has consistently advocated for producing a platform that is conducive for us to practice medicine.
Why is there, I will use that word again, seeming reluctance on the part of policymakers? Because you already identified the fact that we have a Ministry of Health at every state,
Yes.
federal, state, even local governments. Yeah? Why is there a seeming reluctance on the part of policymakers to embrace this ideology?
I like your word seeming. It is only seeming. Because if you speak to all the policymakers, they will agree with you. Okay?
Agreeing and not doing anything.
Exactly. You see, those are the difficult people to debate with. A man who agrees with you, there's no basis for debate. But if they don't agree with you, then you can enlighten them.
What if when they don't do anything?
Well, when they don't do anything, that is the point where you are powerless. That is what makes us so powerless. Because I cannot force you to do something that you don't want to do. You see? So you say, oh yes, that's true. That's the way it's supposed to be done. Then you don't do it. I can't. There's nothing I can do.
But there's nobody that's above the law.
That's true.
Nobody was put there to make policies for himself.
That is true.
Or on behalf of the people.
That is true.
So if the people should say anything, I think democracy said government of the people, for the people, and by the people.
That's true.
It doesn't appear to be any reference to or for the people.
Yes.
In Nigeria.
Yeah.
That is where the contention lies.
But
that's what worries me.
That is again some of the argument of political scientists. Is government of the people, for the people, by the people, a good government for Nigeria? I don't know.
Okay, what other government is that can be good for Nigeria?
Well, just as Winston Churchill said, democracy is a horrible institution except for all the others. Okay?
Say that again. Democracy is a horrible institution.
Yeah, except for all the others.
Except for all the others.
Yes.
Can you expatiate on that?
That means that as bad as democracy is,
still the best.
it's still the best. So democracy itself is not perfect. So what you are describing is the imperfection that is inherent in democracy.
And so people take advantage of that.
Yes.
To the extent that they use it for themselves.
For themselves, absolutely.
At the expense of the people.
Absolutely. Do you think that today, if you decide that, meet Soni Irabor, I am going to contest for the presidency of this country, do you think you will see light of day? There's no even playing ground. You see, this system has entrenched people who want to keep it that way. There's nobody who can just break through the system to become somebody to be recognized. Even if you do, there's no way you can convince the population that you are the best candidate. Where is the platform to do so? You see? So that's what democracy says. So we elect people. I mean, can you imagine a country where we have Nobel Prize winners, Wole Soyinka, where we have Chinua Achebe, where we have Christopher Okim, all these eminent people, okay? Who did we elect as presidents in the past? Look at them.
None of them.
Look at the people who have become presidents of this country. So that's the way it is.
You're saying, therefore, that the rule of law is moribund. It's not really there for anybody to recognize as being worthy of mention, talk less of being used.
Well, the rule of law is only good if it is upheld by people.
And the people are not there to uphold anything.
Yes.
Because they don't even have a chance to speak.
That's right. Institutions in democracy are very fragile. People have to believe in those institutions for them to exist and for them to be sustained.
So, the way you've answered it, I hate to say it, but I will say it, that it's a helpless situation for everybody, and yet the show must go on.
The show must go on, and the show must go on with right-thinking people, people with ideas like yourself.
Who are the right people, the right-thinking people? Who are they?
You and I are conversing now, and you have the ability to reach one or two people. You may be able to win one or two disciples into the fold, and so it is not something we can accomplish overnight. It's a slow process, and as long as we do not give up, as long as we do not relent, then we can only have an aspiration for a success sometime in the future. Even the Bible itself said it. You must not be tired of doing good. You know, if you do good, continue doing it, regardless. Yeah.
Okay. In one of your lectures, you alluded to the fact that any teacher of medicine that still goes to the classroom text and is not evolving, I'm paraphrasing now, is not doing the right thing. Am I right? Do you want to put it in proper, broader perspective?
Yes, it was a lecture that I gave in the University of Ibadan called the Alexander Brown Memorial Lecture in 2002.
Okay.
Where I spoke about the way we teach students, the way we teach students to become doctors. And I said that anybody who is teaching medicine today, the way they learned it yesterday, is doing something wrong. And I still believe that. And the reason is this. Curriculum is meant to serve a society.
Yeah.
This Nigerian society is not static. It's always evolving.
And the youths are showing it.
Yes. So why must the curriculum be static? When I went to medical school, I didn't go to medical school here. I went to medical school in America. But even when I was teaching here in medicine, we did not have this type of problems we have today. The degree of road traffic accidents have multiplied. Okay? Is there road traffic accident management in any medical school curriculum? No. Why not? That is a problem that we need to face.
Even first aid.
Even, all right.
With traumatized patients.
Exactly.
Intensive care.
Exactly. A lot of people, who have accidents die not from the accidents themselves, but from losing blood, bleed by the roadside. And is there anybody who knows how to stop the bleed?
Wow.
See, so these things we are doing here, this mission we came with from Nigeria, from America to Umuahia, one of the things we were teaching is how to stop the bleed. Okay? Simple thing that anybody can do.
Please, can you explain that? Let the ordinary man on the street, people who's watching this, yeah, gain something from that.
Yes. Oh, yes.
What is that? How do you stop blood flow?
Stopping the bleed. You see, there is no big vein that you cannot stop. Even if it means cutting off an arm to save the whole body, you should do it. What about just simply tying off a bleeding leg or a bleeding arm? Just tie it off so that the blood doesn't continue flowing. True, you may lose that leg, but you will save the person.
The whole body.
So these are the things, and what kind of treatments do you give? What kind of management can you administer on the spot? It's a thing that any lay person can learn to do.
Now you've said something that triggers my curiosity again. You take a patient, an accident patient, for example, to a hospital. He doesn't get treated because there's no payment made, no deposit made. What was the whole idea of, are you not trained to save life? Is that not what it is?
We are. We are trained to save lives. So again, I'm glad you brought that up. My pet project now is going around preaching about professionalism. There is a lot of deficiency in our professionalism as physicians. But those deficiencies were dictated by the environment that we live in, you see. So they say you have to pay before we can look at it. If you don't pay, take your picking away. You can't do that. Our profession does not allow that to be the case. Even if you need money, you treat the patient first. Save the patient first. Then we can talk about payment. You know, a patient is taken to a clinic. You say, no, I don't do this work. Take him to another clinic. That is not even professionally acceptable. That clinic must take the patient, stabilize the patient first. Make sure the patient is stable to be transferred to another facility before you let it go. That is the professional way we are taught. So I am thinking that maybe we should begin to include professionalism as a teaching method. We should teach professionalism in schools. But in doing so, I realize that professionalism can differ in different places. But we can teach it. We can teach the concept.
Why do you say you realize professionalism can differ in different places?
Oh, yes, it can. It can.
No, I feel curious, but let me just take a short break so that we can take some messages and we'll be right back.
This weekend and every other weekend,
join us in the mornings at 8 a.m. for a special blend of news.
A different kind of news, where we bring you lively conversations
and a wider perspective on things that happened all through the week in the world, Nigeria, and Africa.
We bring you fresh perspectives, engaging discoveries, and the big stories that matter.
It's Breakfast Extra, Saturdays and Sundays at 8 a.m.
This is Soni Irabor live. Yes. Why do they differ? Professionalism differ in different places?
Yes.
How?
All right. Let me tell you. What is professionally expedient in Lagos may not be professionally expedient in Ibadan. As close as Ibadan and Lagos. Okay? Yes.
I'm finding it difficult to accept that.
All right. I'll tell you that. If I walk into a hospital and I see you as you're dressed now as a doctor, and I see a man with a gbada and big cap and as a doctor, I'll come to you.
Okay, appearance counts.
Appearance counts.
Okay.
Okay? But if in Ibadan, they expect to see a doctor looking so flamboyant, it will not mean a thing to them. But in Lagos, it means something. Okay? In fact, if in Lagos, if I dress the way I am now, you dress the way you are now, and they say, which of these two people is the doctor? I bet you they'll think I'm the one because I have the suit and everything. You see, so those are the differences. That's why professionalism may differ. Where you see what is professional expedient in one place may not be professional expedient in another. However, the basic thing is that you must conduct yourself in a manner that justifies that profession. You see. So I do think that we can teach it. We can teach professionalism clearly.
Can we teach policymakers ways and means of feeling committed to the people they govern?
Yes.
They serve?
Yes, we can.
How?
Well, that is for the political scientists to determine.
Okay, what's your layman's approach to this?
My layman's approach is very simple. Okay. I'm not going to tell you the governors who have reached out to me to be part of their government, but I can tell you that what I told them is that I don't have the skills to be in government.
So you were honest enough about it?
I don't have the skills. If you really want us to, why don't you send us to a place where we can learn skills? All of these parliamentarians and ministers, they have no skills of governance. They have no skills. They have never been taught. They go there and assume authority for the governing of people, a process that they never learned themselves. So they believe that the way to govern the people is to subjugate them, to make them feel ingratiated to you. That is not governance. That is not the way people govern, in my opinion. You see. So, if I were in a position to make policy, in fact, let me not even go far away. Why did they establish the Nigerian Institute for Policy in Guru?
Yes,
It's the same reason.
So why are they not coming out with policymakers that will be sensitive?
That is the point. The point is that that institution itself has been corrupted. So you see a lot of military officers, they went to Kuru, they put the NI something letters after their name because they went to Kuru. What did they get out of it? You see. So even Nigerian government recognized this long ago when they established that institute.
The importance of serving the people.
The importance of serving the people. Absolutely. Absolutely.
You've been away for about 40 years. You're back. You come and go. You see things. You give lectures. But there doesn't appear to be any evolution, as it were. You know, economic, political, social evolution. How does your body, your mind flinch to these thoughts that nothing has changed? Or has any?
Not to my knowledge. I mean, there might be things that have changed, a few of them for the better, a few of them for the worse. Again, this is still the same principle of governance. And an example that I will give is this. I believe, and most people believe, that health care of the citizen is not a privilege. It is a right. And how does a citizen get that right? It is your right of citizenship. Okay? Today, I am also a citizen of the United States of America. Okay. If anything happens to me here now, and the American embassy hears, they will look for me everywhere to take me back there to be cared for. Why? Who am I? They don't know me. I'm just a number. But the mere fact that I'm a citizen, I have earned it. Okay? So all of these citizens, people on the streets, begging people, they are citizens of this country. And they deserve to get value from being citizens. And one of those values is healthcare.
I've gotten two things from what you just said. One is the role of the embassies. Let me now look at Nigerian embassies vis-a-vis how they deal with Nigerians in the diaspora. The second one is people on the street and their right to life.
The people on the streets have no say. And in my opinion, their voices have never been heard. They cannot organize themselves into a force. So they are there at the mercy of those who have.
Well, Professor, before we quickly round off, because time is really of the essence, we've given many messages. Let's just, encapsulate it into short message. What's your message for Nigerian leadership? What's your message for Nigerian followership and healthcare now?
Yeah. My message is simple. My message is that leaders of our country must show evidence that they are worthy of the trust that the people have given to them. Sometimes because the people really did not give them that mandate, they have not felt a need to prove worthy of it. You see, service is a privilege. Service is a privilege. When you ask me to be your minister or your commissioner or your chairman of board or the director of a TV station, when you ask me to do it, you are giving me a privilege to serve. And if I believe in that privilege well enough, I will serve with distinction to make myself worthy of that privilege. We need to teach our leaders to feel that they are serving the people not because they are the best in those positions, but because they have been privileged to do the service. That's what we need to tell our leaders. That's what we need to coach our leaders to do. As for the Nigerian population, I don't even need to tell them. The degree of patriotism in Nigeria, I have not seen anywhere else. People may, no matter what anybody argues, a Nigerian is very proud to be a Nigerian, regardless of the state of decadence that they feel. They feel that they are Nigerians. And they want what is best for this country. They want what is noble for this country, you see. They want to be given a chance to select their leaders, not to be defrauded of that opportunity. That's all they want, you see. So all I can say is that they must not relent. They must continue to persist. They must continue to march along with those people who are like-minded in this struggle for emancipation of ourselves and of our minds. This is all I can tell them. Although I don't know what else I can say that will be better than what they are already doing. With respect to healthcare, we will continue to do our best. We'll continue to advocate for what is best for the Nigerian population in terms of healthcare. We will continue to mobilize all of our colleagues who have skills to transfer to please come to transfer those skills. And we've done a very good job of it in the last 25 years by the Association of Nigerian Physicians in the Americas.
Thank you so very much. This is a very heartwarming interview for me, very in-depth, and I think we got the best out of you.
Well, thank you very much.
Thank you, sir.
It is my pleasure, sir. It's my pleasure. I really feel very honored that you selected me to give this my opinion. And I want to assure you that whatever I'm saying is my personal opinion. I'm not representing anybody. You know, I'm going to be 86 years old.
80 what?
86 in May, in this next month. I'm going to be 86 years old. And I'm just telling you what my own experiences in life, in my journey is. That's what I've tried to share with you.
God bless you, sir.
Thank you very much.
Many, many, many happy returns
You,
and
sir.
many more good years of good health and mind and body.
Thank
you, sir.
Thank you
so
very
much.
Thank you, sir.
Wow.
Thank you.
Okay, so I don't know whether you were with me all the way, but if you weren't, man, you missed. So go back and play that tape because you would love it. I have been with, well, Professor Ajovi Scott Emuakpor. It's a name that every Nigerian should know. But you see, he's been out of Nigeria for about 40 years. He's practiced pediatrics, you said?
Yes.
And health administration as well.
Yes.
For all of those years. He was one time, you know, he said he was deputy, he said he was acting, but to me he was CMD of UBTH, that's University of Benin Teaching Hospital, for all of 4 good years, 82 to 88 or 84 to 88?
84 to 88.
Okay. So, sir, thank you very much. I really am enthralled and I'm happy that we got you.
Thank you very much, sir, for inviting me. I feel very honored by this invitation.
So the journey of 1,000,000 miles begins with one step.
Yes, that's right.
Thank you so
Thank
much,
you.
sir.
Thank
Thank
you
you.
very much.
Thank you. All right, it's been Soni Irabor live. And next week we'll have another very wise person as our guest. We intend to keep it that high and that strong. Thank you for giving us the chance. Bye-bye now.